Assalamualaikum and salam sejahtera, respected viewers and esteemed colleagues. This is the third session of the Safety Awareness webinar series organized by the Safety, Health and Environment National Authority, Shena. Allow us first to introduce ourselves. I am Izzah Allinoor.
I'm Junyi, and both of us are from the Shena Radiation Department. For this webinar, we will share how resilience has helped us to pull through the challenges and maintain our work integrity as regulators of ionizing radiation matters in Brunei Darussalam. There are two parts to this presentation. The first half will be delivered by Izzah, and I will deliver the second half of the presentation. Without further ado, I would like to invite Izzah to begin the presentation with a brief introduction to the Radiation Department.
Thank you, Junyi. Now, as you may know, Shena's vision is to ensure Brunei Darussalam is a safe place to work and live. By virtue of that, we are committed to achieve this through continuous improvement of our processes. Shena is mandated to enforce a number of laws, and one of them is the Radiation Protection Order 2018. The objective of the Radiation Protection Order, which was gazetted in October 2018, is to control and regulate activities which involve ionizing radiation emitted by radioactive materials and control apparatus such as X-ray machine, normally used for diagnostic and security purposes. You ask yourself, so what's the big deal? Yes, it is true that we do not have any nuclear power plants or research reactor here in Brunei Darussalam. However, we do have a small fraction of nuclear materials used mostly by the oil and gas industry. The majority of non-nuclear radioactive materials used in the country does not allow us to dismiss the fact that their hazardous nature can bring harm through overexposure to individuals who are not protected against them. That is why there is a need for activities involving ionizing radiation to be regulated properly and accordingly at all times. It cannot be denied that radiation activities in the country are increasing. As you can see from the slide, we are regulating more than 50 licensees and 400 radiation workers who are currently registered with Shena in accordance with the Radiation Protection Order 2018. This slide shows the different categories of licensees based on their practices. If you look at the medical sector, it makes up to just 7% of the total number of license holders in Brunei Darussalam. Though a silver of the pie, the medical sector is one of the most critical radiation practices in the country due to their application in nuclear technologies used in the diagnostic and treatment of cancer patients. Other licensed organizations are those that engage in the transport of radioactive materials, sales and services, as well as industries. All goes well on our regulatory radar until the COVID-19 pandemic reached Brunei Darussalam in March last year. Brunei Darussalam reported its first COVID-19 case on the 9th March 2020. Soon after that, stringent measures were implemented to curb the spread, where schools were closed, workplaces were also closed, with minimal on-site operations where most workers find themselves working practically from home. Public dining were reduced to takeaways, and cross-border movement were limited to essential travels only. Alhamdulillah, we were blessed. The impact of the pandemic was not as bad as in other countries. However, we are not spared of its consequences. Some workplaces have no choice but to retrench their workers. There were shortages of meat and frozen foodstuff, such that it became quite concerning with some disgruntled citizens inquiring when will sausages and nuggets be available. But life goes on. Amidst the restriction posed by the potential risk to the health of workers, there is still a need to continue essential operations to sustain the economy of the country, and Shena is no different. The COVID-19 pandemic has caused organizations and workers worldwide to face unprecedented challenges in relation to many effects the virus have in the world of work. If you recall, the time when the first case of COVID-19 was reported in Brunei Darussalam, we were all taken aback and many fell into a state of panic as the safety bubble of the country was finally popped by an unknown virus. Tissue papers and antibacterial agents was just disappeared from retail shelf. Face masks appeared on the top of the shopping list. It is amazing how the unknown has its ways of playing with our fears and anxieties. Balancing the fact that we need to still move on, plus the fact that there are risks posed by the unknown, resilience has to be called into play. This is where the World Day for Safety and Health at Work this year focuses on strategies to strengthen occupational safety and health system to build resilience. There was and still impact of the pandemic on how we execute our duties to ensure safety of radiation workers and the public are regulated properly so as to prevent unnecessary overexposure to ionizing radiation. The pandemic has definitely called for a turnaround in how we approach things, from something that was considered as normal back then to a totally different norm at a different level. To address the changes brought about by the new norm requires resilience, not only from the individual but also from the organization. With the National COVID-19 Standard of Procedure (SOP) in force, our inspectors were affected as they were unable to conduct inspection of facilities in seeking verification of compliance with established safety standards. On the inside, competencies of radiation department were also in need of updates, as radiation is an area of fast-paced development in its applied technologies. Enough said from my part. Now, I will hand over the presentation to Junyi to talk about what we did next in order to maintain compromised operation at their best.
Thank you, Izzah. So now what? I'll begin my presentation with what is resilience and its significance. The International Labour Organization, ILO, takes the opportunity from the World Day for Safety and Health 2021 to raise awareness on the importance of creating and investing in a resilient occupational safety and health system. By doing so, unexpected crises could be better mitigated and prevented at the workplace in the future. To put it simply, resilience means how well an organization is able to bounce back and adapt to the new normal quickly while dynamically formulate new strategies as the circumstances change. We all know the devastation and the horror brought by the pandemic to everyone globally, and it definitely has put the resilience of an organization to the test. Now that we have a better understanding on what resilience is all about, we ask ourselves, how can it impact the operational performance of an organization? Most of us being humans are used to our usual way of executing our tasks at work. But what if this is to change suddenly? This is where resilience plays a critical role in the workplace. A resilient organization is always prepared to adapt to the new normal and overturn threats to opportunities and even strive for the better to overcome difficult times. On this slide, allow me to share Shena's personal experience on how we actually responded when the COVID-19 pandemic caught us by surprise. Strong support from a management team that understands the importance of resilience in an organization is prime. A business continuity plan was immediately formulated. It allows us to make use of technology to communicate with our stakeholders. Shena also came up with re-occupancy plan whereby various teams were established to take turns in executing their duties in the office whilst others work from home. In light of the difficulty to interact physically, the radiation department continued to participate in relevant virtual meetings and trainings. Despite this, the national situation was closely monitored by the Ministry of Health and relevant agencies whereby everyone gradually returned to the office to work as the situation lightened up to normal until today. Despite the challenges we faced throughout last year since the outbreak, it did not stop the license applications from coming in. Applications were actively submitted every month. We were thinking, how are we going to maintain our client charter in the face of so much restrictions and safety risks brought about by physical contact? As a team, we found a solution, and that was to implement full electronic submission whereby our applicants were able to submit their license application for review and approval through a dedicated online mechanism. This proved effective in preventing and minimizing as much as possible disruptions to the operations of our licensees and stakeholders. At the same time, we were able to maintain our client charter despite COVID-19. Until today, electronic submission remained the solution to one of our predicaments and is strengthened by the good feedback that we have received from our stakeholders on its usage. All of us are happy. At the end of the day, and in not so many ways, COVID-19 pandemic had taught us that resilience can afford to prepare us for unforeseen events as an organization. Not only it allows operations recovery, but it also maintains good practices in normal day-to-day operations. And most importantly, it was able to generate resilient employees who were able to adapt to imminent change and bounce back quicker to resume a sensible norm. There's no success story that came out from the whole thing, but the true experience that we had undergone just to reach this far is something that we feel is worth sharing with others. How did we improve our organizational resilience in the face of a challenging situation? Through strong leadership and effective engagement. It is crucial to run regular sessions with your team to prepare for the next crisis, as COVID-19 is highly unlikely to be the last crisis that we will encounter in this fast developing world. We are coming to the end, and I would like to close my presentation with a quote I've obtained from a book titled Managing Catastrophic Risks. If your organization has not yet experienced a serious disruption or crisis, it is probably not a question of whether it will occur, but when. A food for thought. Thank you for your time, and we hope you have enjoyed listening to this webinar as much as when we put them together for you. Do stay tuned for the next Safety Awareness webinar series.
Stay safe and have a good day ahead.